favor as your servants, whom you've been pleased to guard the performance of important trusts in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and a faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our country and of those whose interests you've committed to our charge. Amen. Next order.
Order number 1, administration of oath.
Next order.
Order number 2, communication from the chair.
No communication. Next order.
Order number 3, messages.
Next order.
Order number 4, petitions.
There are no petitions. Next order.
Order number 5, papers.
There is a paper to be laid by the Chairperson, Committee on Budget and Appropriations.
Thank you, Mr. Speaker. Mr. Speaker, sir, I wish to read a paper from the Committee on Budget and Appropriation, the report of the Committee on Budget and Appropriation on the Nakuru County Medium-Term Debt Management Strategy Paper 2024. Mr. Speaker, sir, I do read the paper.
Thank you, Chair. Next order.
Order number 6, notices of motion.
There is a notice of motion to be given by the Honorable Chairperson, Committee on Budget and Appropriations.
Mr. Speaker, sir, the House, that pursuant to the provisions of 123 of the PFM Act 2012, this House adopts the report of the Committee on Budget and Appropriation on the Nakuru County Medium-Term Debt Management Strategy Paper 2024. Mr. Speaker, sir, I wish to give a notice of motion on the same.
Thank you. Next order.
Order number 7, statements.
There are no statements. Next order.
Order number 8, motion.
There is a motion by the Chairperson, Committee on Health.
Thank you, Mr. Speaker. Mr. Speaker, I rise to move a motion that this House adopts the report of Health Committee on the visit to Naiswet Hospital. Mr. Speaker, the committee on its mandate, as per the standing orders, we visited the Naiswet Hospital. That is on 24th May 2023 on a venture that is on the objectives of the visit was to assess the status of the Naiswet Health Center and also to ascertain the quality of services offered to the members of the public, also to establish achievements made, challenges and areas of improvement on service delivery. Mr. Speaker, we visited the said facility and we noted that the said facility was opened in 1950 as a dispensary under the Forest Services. It was later improved to a level 3, which is the health center. The facility lies at a 4.5 acres piece of land. It also has another 9 acres currently under cultivation, but has a controversy on ownership. Despite having a large area of operation, a larger proportion of the land is put on cultivation by the management of the facility. There is alleged encroachment of the said land, since there is a member of community who resides within the premises who claims to own the land. The facility, however, has no ownership documents, stroke the title deeds. Services and patients served at NICEWIT health centers. The facility offers services such as curative services, which include TB services, HIV services, pharmacy services, child welfare clinics, which is CWC, labor and delivery services, antenatal clinics, postnatal clinics, and family planning services. The health center serves approximately 100 outpatients with 25 to 50 deliveries done per month. It was noted that the deliveries vary on the various seasons during the year. The major cases reported in the facility include urinary tract, typhoid, diarrhea, pneumonia, and TB. The service delivery in the facility is extremely poor, and I would wish that the members note that. The service delivery in the facility is extremely poor. It is worth noting that by the time the committee visited at around 11:20 a.m., the nursing officer, one Mr. Henlin Joroge, and the lab technician were not in office, while our patient had been in the facility since 8 a.m. Mr. Speaker, I want to put a lot of emphasis there so that respective members from the different areas of representation can be making follow-ups about the operations of their facilities. Because by that time that we were headed to NICEWIT, we were from Joro facility, and we were at approximately or around 9 p.m. And I can tell you the members of Joro facility, of the public from Joro, by that time had already received the medical services. But when we went to NICEWIT, there were no medics. Nobody who was there to attend the patients. And therefore, this calls for the members from different wards to be vigilant and to be on the lookout, to be seeing whether their facilities are opened on time, whether there are people to attend the members of the public, and if such kind of concerns will be raised, we'll be able even to follow up and to come up with proper mechanisms of making sure that we can be able actually to supervise whatever the executive is offering to us. There still exists an incomplete maternity ward under construction that was started in November 2022, and the project was funded by the World Bank through the county government. There are 3 wooden toilets in the facility which are in poor condition and are used to cater for both the staffs and the patients. And also there, Mr. Speaker, allow me to say that actually there is also a person who resides within the compound of the facility and he uses the same washrooms, Mr. Speaker, which actually compromises everything. The hygiene levels in the facility and the toilets are not appealing. This is one of the dilapidated facilities that I've ever visited in my tenure or in my lane or when I've been in this assembly. The facility is poorly organized as there is no flow on how the patient gets assistance. The place where the waiting bay is located is too cold, thus patients prefer to wait in the scorching sun. The structure in the facility are outdated and dilapidated. The services offered are free of charge, however the drugs are insufficient. There is a laboratory in the facility which is not adequately equipped, making the patient to seek services from private facilities or hospitals around. Mr. Speaker, it was alarming, and we thought of it that the nursing officer who was in charge, when actually he realized that we were around, he came actually running. I thought that actually he was in one of his private facility around there, and therefore this report, when it will be reaching on the other side, we want proper response as a house as far as this facility is concerned. There is a laboratory in this facility which is not adequately equipped, making the patient to seek services from private hospitals around. In conclusion, The facility has no ambulance, thus relies on the one from Njoro Sub-County Hospital in case of emergencies. There is service charter in this report that have already been actually have been equipped in this report. Members can see the kind of services that are offered there, and also the time that members of the public are supposed to wait, which is ironical because if we had arrived at 11:20 and by 8 a.m. that's when the patient arrived at the facility, then even this service charter does not hold water, and it needs actually to be changed if need be. Staff establishment. The facility currently has a current staff establishment of 12 staffs. These are permanent, contractual, and casual staffs. That is, number one, clinical officer, they have 2. Number 2, they have 8 nurses, 1 lab technician, and 1 support staff. It is worth noting that the officer in charge seems unbothered with the services offered to the patients. He is not concerned about the absenteeism of his colleagues because he also comes later to the facility, to the health facility. The health center has shortage of staff and equipment are not sufficient for it to function fully. Those are the members of the committee that visited. We also have the facility has a consultation room. And I can tell you the kind of the consultation room that we saw there, Mr. Speaker, it was not good anyway. It was not good. And it bothered us actually to believe that a facility that was established in 1950 still holds the kind of the status that we saw. Mr. Speaker, the consultation room was very small, and it doubles as an injection room, examination room, procedure room for outpatient. The patients have to wait in the scorching sun as they are attended to slowly by 1 nurse. There are few procedures done in the consultation room due to staffing problems. TB and HIV testing is also done in that small room. The room's ceiling is in bad shape and hygiene is not well maintained. You can see the kind of rooms that we have there, the consultation room, a very tiny cubicle thing that we wondered whether we are still in this devolution era whereby things should be done in an appropriate manner and where facilities should be offering therapeutic environment. Even without being attended to, you are supposed to be cured by the environment of the facility, but now things are different there. Child welfare clinic. The child welfare clinic is in the same building as the maternal child and health and the delivery room, which is the first building from the health center gates. The room has a horizontally wooden height measuring instrument and metallic weight measure for the baby. Records are also kept in this room. It also serves as a waiting room, and immunization is done in the room. Maternal child health. The facility has a maternity ward where they receive postnatal care and support for the mothers and their newborns. The maternity room has 4-bed capacity. The facility has allowed 25 to 50 deliveries monthly, while emergencies and delicate cases are referred to Njoro Sub-County Hospital. And Mr. Speaker, when we say that they are being referred to Njoro Sub-County, unless the ongoing construction gets actually completion, Njoro Sub-County facility cannot receive the kind of referrals that the status of services offered by that Njoro referral do not commensurate to the status of that facility. And therefore, we request that as also we are passing this report, we consider bothering the executive to complete Njoro facility so that it can be the hub for that region, because currently, if my mother will be referred to Njoro, definitely they will learn to PGH because Njoro facility is not in the proper status of accommodating those referrals that are expected to come from all over Njoro sub-county. Delivery room. The delivery room in a hospital is where childbirth takes place, providing a safe and controlled environment for labor, delivery, and immediate medical care for the newborn. The facility has 1 delivery bed in the delivery room. There is one incubator and no resuscitator. You can see the delivery room and also the room and the bathroom that they have there. Then we have the laboratory room. The laboratory is quite small and wooden. It is this where actually they could do their examinations, their medical examinations to the reagents or rather the samples carried out from the patients to determine or to diagnose what is affecting them. You can see the kind of the laboratory they have. And I wonder in this generation where we have those such kind of the facilities. Therefore, something ought to be done there. Committee findings. The facility has insufficient supply of drugs. The facility lacks an ambulance, and emergencies are responded to by the ambulance from Joro Sub-County Hospital. Naiswet Health Center faces staff shortage, especially lack of pharmacists. There is laxity in service delivery where the nursing officer in charge, Mr. Henry Njoroge, was not in by 11:20 a.m. Specifically during the day, the committee made the visit, during that day that when we visited, this one, Njoroge, was not in that facility, and therefore we want actually the department to do something about it. Although the maternity operates on 24-hour schedule, there are few equipment to facilitate the high number of births. Naiswet Health Center has no ownership document. That's why anybody can come and start actually living or residing within the county land. And therefore, Mr. Speaker, I request this House to implore the Lands Committee to go to that facility immediately and determine what is an outsider or an alien is doing into our facility, as we also wait for the other side, that is executive, also to give us the proper local standard of that facility or about ownership about that land. Although the hospital has a large portion of land, it is underutilized. The facility lacks good proper laboratory equipment. The toilets are extremely in poor conditions and are few in number. The facility has insufficient supply of water. The staff quarters do not have toilets. The hospital was allocated 2 million for installation of perimeter wall and 2 million for renovation and equipping of the outpatient hospital block in the budget estimates. The budget estimates for the financial year 2023-2024 from the Naiswet Ward Kitty, not from the Njoro Ward Kitty. The facility has outdated and dilapidated structures. The rooms are not well ventilated and they are extremely cold. There is new maternity structure under construction. Recommendations. That the county government of Nakuru should work in collaboration with KEMSA to ensure timely and sufficient drug supply. And Mr. Speaker, when we came up with that recommendation, if you look at our budget, Mr. Speaker, what we give to the department and what we usually find onto the ground, Mr. Speaker, it does not commensurate. And therefore, Mr. Speaker, I also request the implementation committee to be vigilant on these matters of budget implementation together with the budget committee so that they be seeing whether whatever we've been passing as a house is actually landing or where the Mwananchi is. Because to some extent, Mr. Speaker, this outcry of lack of drugs is so rampant to some extent, Mr. Speaker. We wonder whether we increase the amount or rather what we are supposed to do, Mr. Speaker, so that, Mr. Speaker, our facilities can be sorted and we can be assured that once we appropriate the monies, Mr. Speaker, for drugs, we have enough drugs and we have proper drugs. However, Mr. Speaker, there is issues to do with the KEMSA. When they are asked to deliver drugs to a facility, they just deliver whatever is onto their disposal. And therefore, Mr. Speaker, we would wish to actually also not only to implore the executive, but also the Council of Governors and the Senate to rein on this matter with the Ministry of Health so that things can change, so that KEMSA can restructure themselves, Mr. Speaker. Therefore, Mr. Speaker, I would wish whatever we can be able to do at our reach, let us do it, Mr. Speaker, as also we look forward to engaging other stakeholders so that this KEMSA thing, this animal that we call KEMSA, can be able to do its work properly. Number two, that the county government of Nakuru should allocate more resources in the financial year 2024-2025 for recruitment of staffs, such as pharmacists, improve the laboratory and other infrastructure for the facility, equipping the facility with at least one other delivery bed and postnatal ward beds. That the Department of Health should work in collaboration with the Department of Land, Housing and Physical Planning to fast track on the issues of the facility title deed, because, Mr. Speaker, it's ugly when a citizen goes to a facility and claims that he owns that land. How I wish that the Lands Committee can take this matter urgently and head there so that at least we can have sanity in that facility. Number four, that the Department of Health Services should improve the health standards of the facility. That the Department of Health, in collaboration with the Department of Environment, should plant more trees at the facility. That the Department of Health should undertake cross-monitoring of the facility to enhance effective service delivery. That the facility management should innovate ways of utilizing the facility lands to generate revenue for the facility. That the facility management and Department of Health should monitor, supervise the construction of new maternity to be completed as per the contract period. Mr. Speaker, I beg to request this House to adopt these reports and also to make sure that relevant committees do their work of follow-ups so that whatever we recommend, Mr. Speaker, we can see the fruits. Let us not actually labor in vain, such that the health committee, its work is actually to go out to the ground, come up with the findings, but those findings are lacks follow-ups. I request relevant committees, Mr. Speaker, to take these matters onto their hands and do the necessary, Mr. Speaker, so that we can rescue the status of our health facility across the county. Mr. Speaker, I beg to request Honorable Chair for the Budget to second.
Thank you, Mr. Speaker. Mr. Speaker, because I wish to give also my own contribution, at this juncture I wish to second the report, Mr. Speaker, sir. Thank you, Mr. Speaker.
Thank you. The motion is that this House adopts the report of the Committee on Health Services on the visit to Naiswet Health Center on 24th May 2023 that was laid on the table of the Assembly on Tuesday 20th February 2024 during the morning sitting. The motion is open for debate. Honorable Member for Lakeview.
Thank you very much, Mr. Speaker. Mr. Speaker, I'm a member of this Committee on Health, and first and foremost, I wish to give my own regards to our chairperson, Committee on Health, Honorable Njuguna from Elbagon, because of his leadership within this committee. Mr. Speaker, indeed, we have had time to visit various institutions under his leadership, Mr. Speaker. And, Mr. Speaker, most of these institutions that we visit, they are not in good condition, Mr. Speaker. The report that you've just listened to, Mr. Speaker, or that has been tabled here, Mr. Speaker, is one that should be taken with so much caution, Mr. Speaker, from all the people who are in charge of such of the health matters within the county. If you go to this hospital in Naisut, and you find that the staff are sharing a toilet with the patients, Mr. Speaker, you find that we are not in a good condition as a county, and more so at the primary level of our own health facilities. You find that in this hospital, the toilets are wooden. I don't know where in our century we have wooden toilets within our republic at the time. And I would wish to ask even the area member of the county assembly from that area to do something for such people. Mr. Speaker, you have patients waiting outside in the morning, in the cold, very early in the morning, waiting to be treated, and yet these patients have come to that hospital to seek medication, and you are facilitating for them to get pneumococcal diseases, Mr. Speaker, it is not fair that these people have just been left on their own. You have been told within the report that the hospital experiences so much of urinary tract infections. When you get urinary tract infection, one of the things that facilitates that, Mr. Speaker, is poor hygiene, and more so on the latrines of the toilets that we have. If then this is the case, and you don't have toilet facilities that can contain and curb such condition, we are headed for a very extreme and dangerous way as a county, and more so for the people of that area. Mr. Speaker, the facility has no any land ownership, and I wish to get a report, Mr. Speaker, on how many title deeds that we possess as a county for all the facilities that are owned by the county government of Nakuru. Because there's a department, Mr. Speaker, that maybe went to slumberland, and that is the department on lands, Mr. Speaker. This, I remember last year, Mr. Speaker, when we came to this assembly, we all stated that most of our facilities have no documents. Not just this one. We have Naivasha Level 4. We have Moro. We have Maimahiu. All these lands that we have placed millions and millions, almost billions. Because the health department, Mr. Speaker, we are talking about a budget of 38.1% of the total budget of Nakuru County. And we don't have documentation for such places that we do so much investment. When you bring lands there, Mr. Speaker, you get that we must get a clear way of working within that area. When you go to the rate at which children are born within that area, we get 25 to 50 voters per month within that area. So that is an area that people are so productive. And hence, Mr. Speaker, the only thing that we can be fair with them is we ensure that the facility there is well kept and well done, so that we can also engage these members of the community in a better way. Mr. Speaker, we have brought so many reports within this assembly. And in the last meeting, I think the chairperson gave us a direction that now we shall not go to the curative part, we shall now move to the preventive part. And we shall be visiting maybe the different estates, and we see the conditions that as to how the people live within those areas. That is in the Department of the Public Health. And the question that I ask myself, Mr. Speaker, the members of this House, when they visit these hospitals or these clinics that they have within their wards, what comes in their minds, Mr. Speaker? Because I think apart from waiting for the HQ projects on hospitals within our areas, it is also prudent that we also appropriate money from our own ward kitty to face such calamities that befall our people. Because the situation in Naisut, Mr. Speaker, is not a laughing situation. Those are humans that are living as though they are in the medieval age, Mr. Speaker, which is not allowed at this time and era within the country. Mr. Speaker, we ought to really think on how we facilitate, because if that is necessary, Mr. Speaker, I wonder how another clinic, maybe in Keringet, will look like, Mr. Speaker, because the further you go, the worse it becomes, Mr. Speaker. It would be very, very necessary that we now start being serious on how our own people are living at the ground. And hence, Mr. Speaker, I wish to support this report and wish that we can get a clear indication on the way forward from the side of the executive and also from the area members of the county assembly. Because, Mr. Speaker, we have 1.65 billion Kenyan shillings that we normally appropriate to the ward levels. Where do these amounts go if not to help such people, whereby they are as though they are being led to their death beds in such clinics or such health centers within our county and within our own hospitals? It is good that we deal with such reports. And that's why you find, Mr. Speaker, If you can have a wooden everything in a clinic that is giving us 25 to 50 deliveries in a month, Mr. Speaker, this is what is causing an uproar within the nation, because you find that we have a generation that is not understanding what is happening within our own systems. And the generation has decided that things must go straight. And hence, Mr. Speaker, let us not deal with a problem when it gets out of hand. Such things should be dealt with at the moment. We cannot be going to visit a center and we get another person staying within the same hospital and claiming this is my own land, and the county has mechanisms of ensuring that we get title deeds of all the lands that we possess as a county. It is unfortunate, and I think the chairperson lands should also come here, and the deputy chair should come and give us the status of the title deeds that we have as a county government, so that we know how many title deeds since we came in with the government of Her Excellency Susan Kihika we have been able to obtain for the purpose of public use in this regime, Mr. Speaker. It will be only proper that we now shift our attention and really possess our people and possess the institution that we had. Because past the time that we get out of this assembly, what will we be remembered for? What did we do? If we can have such a health facility at the extreme of Naisut, what about the other parts that we have within this sub-county, this county, and the great county of Nakuru, Mr. Speaker? Mr. Speaker, I wish to support this report and ask members to visit their health centers where they come from. Thank you, Mr. Speaker, sir.
Thank you. The Honourable Member for Kerrigat and the Honourable Member for Kiptagich, in that order.
Thank you very much, Mr. Speaker, sir. I support this report, and I take this time to congratulate the committee for finding that report. Mr. Speaker, sir, I have some input to put across concerning this report. Mr. Speaker, sir, Naswet has just been mentioned as a replica of a good number of facilities that we have around in this county. And sincerely speaking, I want to start by saying that this has actually tainted our county in a very bad manner. Because if we still have this kind of facilities at this point in time, I think something should actually be done. Mr. Speaker, so much has been said about the shortcomings in the facility, and it being an old facility that was started way back in 1950. And to date, such kind of a bad report can be given. It means that there is a lot that actually should be done as soon as possible. Mr. Speaker, sir, the chairman has just pinpointed that the facilities are actually wooden. Most of the facilities are wooden. But to me, wood is not the problem. Because for sure, even in our assembly here, you can see it's so nice, and most of the parts are actually made up of wood, so wood is not the problem. The problem is the management. I think the management should actually be probed so that we can know why they have not actually taken steps to ensure that they are meeting the standards that are required. It has even been mentioned that they're using a common toilet. You are quite sure, Mr. Speaker, that even here in the Assembly, we use the common toilets. But there is no problem with that. The problem is that the Speaker, the Chairman has just said that they are in dilapidated conditions, meaning that not much has been done to ensure that They are actually renovated. They are kept to meet the standards that are required. So I think in your recommendations, Mr. Chairman, you didn't really mention that the management should actually do something to that effect to improve the conditions. Another issue, Mr. Speaker, is concerning the inefficiency of the staff. If you have said that Mr. Njoroge, the nurse in charge, arrived at 11, that in itself shows that there is a lot of disconnect between the management, the staff, and anybody can decide on what to do. So somebody coming to the hospital sincerely at that period of time and somebody is in charge shows that there is a lot of laxity. My main questions are, could the environment have actually demoralized these people? Because you've talked about very poor, you've never seen. In fact, the chair budget has just been pointed that if it is so in Aswet, what about Kerenget? I want to tell you, Mr. Chair, that we are so much advanced. We are not at that level. Kerenget, we are doing well, and our facilities are not badly off. So don't compare us with this hospital, because sincerely speaking, I think there is something amiss. Mr. Speaker, sir, I just want to say that going forward, some more visitations should actually be made to this hospital. We need the persons concerned in the ministry to go there and really find out why such conditions are prevailing at this point in time. Otherwise, I support the report and I congratulate the committee for the good work that they are doing. Thank you.
Thank you. The member for Kiptagich.
Thank you, Mr. Speaker, sir. I'm Rose from Kiptagich. I just want to echo with my team from the Health Committee, because when we went to Naswet, we saw the rooms were not ventilated and they were extremely cold. We saw some of the ceiling that were destroyed, and as we have seen, that deliveries are 25 to 50. If not for that, I could see that 100 or 120 deliveries could be got by a month. Another thing is about small consultation room where we saw injection are done. It is examination room. It is again where they do procedural for outpatient, and we saw that one nurse could attend them. So it was really very difficult, and I'm requesting honorable member from Naswet to do something. Thank you, Mr. Speaker, sir.
Thank you. The member for Shabab, and then the member for Nakuru East.
Thank you, Mr. Speaker. I'd like to congratulate the Committee on Health for the good work that they've done by giving us this report. And Mr. Speaker, the Committee on Health has brought us a lot of reports here, and I want to point one issue that has been persistent in the report. This is about the issue of drugs. Every time they give us a report, you hear this issue that there are no drugs in the hospital. And maybe, Mr. Speaker, it's a high time they look into that issue. Because, Mr. Speaker, I guess with the digital world, Mr. Speaker, the committee can recommend the county government to digitalize the issue of drugs in the dispensaries, and maybe connect all the dispensaries with the headquarters and the drugstore, so that maybe from a point of where the person in charge of drugs is sitting, he can be able to monitor how drugs are being used in the facilities, in the health centers, in all the facilities in the county, Mr. Speaker. And maybe that will assist in maybe knowing how when one facility needs to be restocked, they will monitor the stocks in the facilities, Mr. Speaker. So, Mr. Speaker, I rise to support this report and also recommend that all the facilities in the county of Nakuru be digitalized and they monitor the drugs issue. Thank you, Mr. Speaker.
The Honourable Member for Shabab, maybe you need to bring a substantive motion on that.
I stand guided, Mr. Speaker.
Thank you for that proposal. The Honourable Member for Nakuru East.
Thank you so much, Mr. Speaker, for giving me this chance. First and foremost, let me commend the Committee on Health for the good work that they've done. Indeed, this committee have been giving us business for this House. We've been discussing these reports not once. I think this is like the 10th report they are bringing in this House. But, Mr. Speaker, sir, many issues have been repeating themselves. The issue of land ownership, the issue of drugs and all that. But in particular to this report, Mr. Speaker, sir, there is nothing to smile about. Many findings and recommendations from the committee have been negative. In fact, the only positive recommendation or the finding that I have found in this report is that the facility has adequate water. But other issues, they are wanting. Mr. Speaker, sir, I think it is high time now as a House we speeden up on the recommendation of calling up the CEC and CEOs in this House so that they can come and we have some commitments from the executive side of the government. In fact, it has been alluded by the chairman budget that as this House, the Wards Kitty, we have 1.65 billion to share. But I wonder, the executive has a lot of money that they are supposed to take care of. Because you see, this facility was built in 1950s. And this, it's a clear indication of a failure of the system. Because when the chairman of budget was talking, he was trying to blame it to the member of that ward. And I think I want to commend the member of Naiswet Ward because from the findings and recommendations that we've seen, the last financial year he's allocated 4 million from the small money that he's getting. So I want to commend that member of that ward and also to say that now the executive should be serious on this issue because of late we've been seeing the CEC Health going around the facilities. We need to, the Committee on Health, to call the CEC and let her give her the commitment from the executive so that as a county, we are so ashamed to have such a facility in our county. So it is high time the executive should take care of our people. We should not be gambling of our people. We all have the mandate to deliver to our people, and that is why we are elected, and that is why we are here to appropriate money and do so in a manner to So, Mr. Speaker, with those remarks, I want to support the report and say that we need now to see actions being done by the executive arm of the government. Thank you, Mr. Speaker.
Thank you. The member for London.
Thank you, Mr. Speaker, for this opportunity. I also take this opportunity to commend the Committee on Health for the good job that they have done, and I stand to support this report. Mr. Speaker, sir, I believe we have a thorn issue in terms of public lands. And it is high time happening that lands department are collecting data so that they can be able to realize the lands that we have, public lands that we have. So it is, to some extent, Mr. Speaker, sir, we request of them not only to collect data, but also to appropriate money to fence this facility, because how things are rolling forward, Mr. In future, we may intend to have lands so that we can be able to do expansion of facilities because of the population that is growing, Mr. Speaker, sir. Mr. Speaker, sir, it is said health is wealth. And going by the report, in terms of hygiene standards, are not up to standard or are questionable, especially the sanitation facility. It is not inviting our patients to go to such facilities. Hence, Mr. Speaker, sir, I believe there are those short terms that can be done within the facilities, and there are those maybe long term that need departments to intervene so that they can be done. So, Mr. Speaker, sir, I believe we are supposed to look into that much so that we can be able to raise the sanitation standard or the hygiene standard in such a facility. Mr. Speaker, sir, I believe happening that we have a chair, a health committee here, I believe there is funds, FIF, facility improvement funds, which are supposed to buy medicine in hospital and do some improvement within the hospital facilities or like PGH and so other facilities. I don't know whether they are utilized rightly, how they are supposed to be utilized, Mr. Speaker, sir, and it is a concern so that we can be able to improve our facilities. Mr. Speaker, sir, I believe lands that has been grabbed that are supposed to be for public. I believe it is high time that we look on how we can be able to revert, even though the cost of reverting these lands is not that easy. That's the reason as to why we are saying, it is our opinion that they are fenced so that we cannot incur such cost, because the money that are utilized to revert our lands back can be used in so other development in this county, Mr. Speaker, sir. So, Mr. Speaker, sir, those are my few remarks. Thank you, and I raise to support the report.
The member for Barut.
Thank you very much, Mr. Speaker, sir, for this opportunity. I stand to support Committee on Health, also to congratulate the chair for the good work they are doing, Mr. Speaker. Mr. Speaker, we have heard many things about Neswet dispensaries, and I think Mheshimiwa from that ward will going to sort out the messes that are in his ward. What I wanted to say, Mr. Speaker, is that the Committee on Health, they have tabled so many reports before this House, Mr. Speaker, and we have never had or see anything being implemented by the Committee on Implementation. And I saw the Mheshimiwa from, I saw the chair, Mheshimiwa Mwangi from Turi, that he has disappeared, Mr. Speaker. I wanted to address him to at least do something, because it is now 2 years, but you have never had anything being implemented in terms of reports being tabled before this House. So I think, Mr. Speaker, something must be done so that when we at least do something, we are assured that things are going to run as we deserve, Mr. Speaker. So thank you.
Thank you. The honourable member for Barut. The honourable member from Rongai.
Thank you so much, Mr. Speaker. And I also want to commend on the work of the Committee on Health. Being a member, Mr. Speaker, the report that is coming from Neswit Ward, Mr. Speaker, is not a good report, and it is quite disturbing. On the issues of, and I know, Mr. Speaker, sir, when the issues of health are coming up, Mr. Speaker, the people who suffers most, Mr. Speaker, are the women and the children. So, Mr. Speaker, I've seen also there is a laxity in service delivery, where the nursing officer in charge is not quite committed to the work, and that is quite worrying. I don't know, Mr. Speaker, sir, even these nurses are, the question that rings in my mind is, are these nurses motivated to work, to do their work? So these issues is quite clear that some nurses maybe do not even report to their work, the issues of supervision, which should be looked into, Mr. Speaker, the issues of maternity operation. You realize that, Mr. Speaker, these areas of Naiswet are the most affected, and they have quite a number or high number of early pregnancies, Mr. Speaker. And this one, the executive arm of the government, Mr. Speaker, so should also look into it and see the issues of sensitization and also the issues of school early pregnancies in schools, and should be looked into, Mr. Speaker. The issues of culture also, I know it comes out clearly in these areas, and people the executive should look into this matter seriously and see how they can help such wards that requires our support, Mr. Speaker. And the issue of maternity is quite disturbing also. You realize that they have very few equipments, and the number of women giving birth is quite high, Mr. Speaker. So being a woman in this assembly, I know it is not a good image, and this should be looked into quite seriously. As a woman who has given birth, Mr. Speaker, it is the requirement of every maternity that they have the required equipments, Mr. Speaker. So, Mr. Speaker, sir, I do support the sentiment of the members that these facilities should be clearly looked into and ensure that they have the required equipments to operate as a maternity and also as a health center. Thank you, Mr. Speaker.
Thank you, Honorable Member. The member for Kapkures, and then the last member will be the member for Kamara.
Thank you. Thank you so much, Mr. Speaker. I also rise to support the report and congratulate Committee on Health for the good work they have done. However, Mr. Speaker, the report they have given us is not good. It has tainted not only Naiswet ward, but all the Department of Health with a very bad picture in that services are not rendered to our people as intended to be done. It is very ironical, Mr. Speaker, that we use 40% of our budget on health, and it is not felt in our facilities. The issue of drugs have been a thorn in our flesh for several years now, Mr. Speaker. I will urge that department to keenly resolve this issue of drugs in our facilities. The laxity of staff, the nursing staff in Naiswet, coming to work at 11 a.m. means that most of the patients might lose their lives just waiting to be served in a health facility. I will urge the Committee on Health to do such visits in several facilities in our county, because this might be just one of the very many facilities which have laxity in service delivery to Mwananchi. Mr. Speaker, as the issue has arisen that the ownership documents in Naiswet Health Center, there is a problem in ownership documents. I wish the departments, the Committee on Lands and the Executive Department on Lands to do thorough visits to all our facilities, not only Naiswet, and ascertain that before we develop any facility, we own the facility totally, Mr. Speaker. Our project, we should have all title deeds before we develop. However, I support the report, Mr. Speaker. Thank you.
Thank you. The member for Kamara.
Thank you, Mr. Speaker. Also raised to support the report. And also want to congratulate the Health Committee. They did a good report, and I believe that's the way to go. On the issue of Neswet, the only thing I admired of Neswet is the signboard at the road. It is beautiful. County government Nakuru, Bear Box, Das Njoro. That's the beautiful thing only on Neswet ward. I also believe, Mr. Speaker, the member of Neswet has been in this house for almost 3 terms. You know, when you are a member of the house and you don't own your area, that is what can be seen. Because I believe each and every year, each and every financial year, the money has been allocated to this facility. But what is it? A wooden structure in the 21st century is a shame to us and shame to health sectors. I believe if those wooden structures now, that the way they are wooden, even the floor itself can be very bad. And you know about these areas of Neswet, it's a cold area, sort of a forest-like. And I believe, Mr. Speaker, wherever there is cold, we expect a lot of maternities and a lot of kids to be born. If now that they are going to be brought up out of these structures, do you think that gentleman or anyone born here can be raised truly to be a leader in future? No. My question can be no. Because recall now that I believe even the midwives are the one doing the bathing or doing everything in that maternity, which is not okay. So I believe it's high time that as members of a county assembly, we need to hone what structures in a given area. And I believe also Mheshimiwa from Kajwang has done greater than this. I believe there is no wooden structures in your given ward. Asante sana, Mr. Speaker. Thank you.
The honourable member for Kaptembo, you've been mentioned. You want to clarify?
Yes, I want to clarify, Mr. Speaker, and even give a small contribution to this motion. Mr. Speaker, I was one of the members who visited this facility, and my finding and that of the committee resonate to what Member for Kamara is saying. Mr. Speaker, Neswet has only one health center, only one in the entire ward. And the member of the county assembly has been in this house for over 15 years. Mr. Speaker, that is something that we cannot just ignore. When these people go for public participation and prioritize which project they want to do for their ward, how comes they don't see the hospital? Mr. Speaker, it's a shame. It's a very big shame because, as for me, in Kaptembwa, our biggest priority is the health center. And Mr. Speaker, I would invite you to come to Kaptembwa and visit Rhonda Clinic, and you see for yourself the state of art of health center that we have there. So I think the members, the community of Nisit need to rise up to the occasion and realize that the biggest priority is the health sector and the health facility. Mr. Speaker, this House loves the people of Nisit, but the member of County Assembly love them most. And they love him because they keep on electing him. So in this conversation, Mr. Speaker, the direct challenge goes to the member of County Assembly for Nisit, that you need to rise up to the occasion and let this kind of embarrassing report never reappear again, because I know that he has an allocation of over 20 million year in, year out. Mr. Speaker, for 15 years, you cannot even build a toilet. A toilet, I was there. You cannot even stand being in that toilet for 1 minute. Mr. Speaker, you'll think that you've been exposed to a gas chamber. It's so bad, you know. Mr. Speaker, with these few remarks, that one is a direct challenge to the member of County Assembly for Nesset. Thank you, Mr. Speaker. I beg to support the report.
Thank you. Thank you. The honourable member for Kaptembo, who also happens to be a member of this committee. So, Chair, you're going to have your time to respond. Before you come up, the Chairman Committee on Implementation, he walked out. Yeah, he was mentioned that he hasn't, that is serious, that he hasn't brought a report to this House. Whether it's true or not, it's only him and the committee that can confirm that. Vice Chairperson, Committee on Implementation. A member? So you give this information to the chair that this is part of your work. You may be seated. The reports that have been adopted on the floor of this house, you may not involve yourself so much on the issues of budgeting and issues of the budgetary allocations. But for any report that has been considered and adopted in this honorable house, then it is your work to see that it is followed up and there is action, so that now this house does not turn into a house of reports and no action. So the Honorable Chairperson, Committee on Health Services, you, in the coming days, you may also need to inform the House that the health sector, because it has been said that it carries around 39% of the total budget, you will need to inform the members of how this money is shared, because it could be maybe a misconception that all the money goes to services and infrastructures, but you may find that what really the health committee or the health ministry or department gets, really, it's not all that. The money from the exchequer, you may need to check on that, so that should there be need that this house is going to increase the amount of money is given to this department, so that need to be considered. So, Chair, you have your time to respond.
Thank you, Mr. Speaker. Mr. Speaker, allow me to respond to various concerns that have been raised by the members, starting with member for Keringet, whereby he alluded that there is no problem for the medics and the patient to interact in the same washrooms. Mr. Speaker, some of the diseases, there is a way that the environment itself can be contaminated, and the medics can pass even those diseases to the patients. Therefore, much of the time, and as according to the regulations of the WHO, they are not supposed to interact. They are supposed to be in their own private rooms, whereby they can be able even to brush and scrub themselves, so that when they go to attend to the other patients, there is no contamination. Once they contaminate their bodies, all their whatever the clothes they have, they will end up contaminating the whole populations. That is the reason as to why we said it is good also for the medics to have their own washrooms, their own toilets, and even their own way of of the standards of living should be up there, so that they will not actually pass the diseases to the other patients who will be coming. Therefore, that's the reason, that's the major reasons, and I would wish that that facility should have the standard washrooms for the medics and for the patients. Number two, Mr. Speaker, the Honourable Member for Kapkures have said that we are tainting the image. Mr. Speaker, our work is oversight. And the day that we are going actually to behave, that if we have become executive, then we don't have any business to be in this house. We are supposed to be at home. Our work is to tell the department, look, you are supposed to improve here. You are supposed to do this and that. Mr. Speaker, therefore, I would wish to tell the member, or to respond to the member and to request him, that our work is not actually witch hunting. We are not witch hunting. We are doing what is mandated to us by the Constitution, and we are doing our work, and that's why we are paid, Mr. Speaker, to do such kind of work. Mr. Speaker, the member for the Nice have also been reprimanded by Honorable Kajwang and the rest, Mr. Speaker. Mr. Speaker, the Honorable member, perhaps he have tried, according to his own knowledge, But however, Mr. Speaker, a lot ought to be done by each and every member to make sure that their wards, their facilities are updated and they are actually up to standard so that they can offer quality services. Mr. Speaker, allow me to tell these members, if you can get sick to some extent, the first place that your people think to take you so that you can be given first aid, it is in those facilities. So those facilities do not belong to those members that we represent. They belong to us. And Mr. Speaker, I usually request this member, even if you are not sick, you can go for dewormers in those facilities. You can go for HOTS in those facilities. Therefore, Mr. Speaker, and I will request Honorable Kajwang, because I know he usually go to his facility, to also request and reference other members to be going to those facilities just to see whatever is happening there, Mr. Speaker, so that even the medics and those who are operating in those facilities can at least change. Therefore, Mr. Speaker, I would wish that going forward, and if we have the even supplementaries, let the members check onto whatever is happening in their facilities so that actually the status and the standards can improve. Mr. Speaker, also, I want to say that in a while, before even we go to the supplementary, perhaps don't have enough money. And majorly, the drugs alone. And I want to say, the kind of the drugs that we receive, they are very expensive. The kind of infrastructure that generally we have, they are very, 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 very expensive. And even the medical technology that we learn in our facilities, it's high tech and it's very expensive. And Mr. Speaker, what is constituting that 7.7 part of the budget that we have, it's not normally what we get from the exchequer. It's what we are collecting as FIF. It's the money from those facilities. The targets that those facilities will be collecting is what is constituting that 7.7% of that budget. Therefore, in entirely, we really need the support, and we request the members to support us with the funding so that we can be able to improve. Mr. Speaker, finally, there are issues of some of the medics that we found in those facilities. They are no longer there. The NGOs that were supporting them have withdrawn the support to the counties. And therefore, I can say we are in a critical times, and we really need the proper support so that we can employ enough staff so that they can be able to offer services to the growing population of Nakuru. Therefore, Mr. Speaker, I beg to request the members to pass this report and the necessary committee to take over this matter and ensure that this report will be tabled back. Not even going for those 6 months that we have been saying traditionally, but immediately, Mr. Speaker, because this is a matter of calling the department to come and they respond and they give us the time frames as to when they are going to implement, and then the committee go back there to counter-check whether these things, the recommendations, have been implemented. I beg to request the members to support.
Thank you. I now proceed to put it to question. That this House adopts the report of the Committee on Health Services on the visit to Naiswet Health Center on 24th May 2023, laid on the table of the Assembly on Tuesday 20th February 2024 during the morning sitting. As many who are of that opinion say aye. As many who are of contrary opinion say nay. The ayes have it. Next order.
Mr. Speaker, sir, those are the orders of the sitting.
Honorable members, this House is adjourned to 2:30 p.m. this afternoon. Thank you.